Is it okay if I pull your pant leg?
Yep.
Okay. So bladder 57 here, if you measure half the distance between bladder 40 here at the back of the knee and bladder 60 here, again there's about 16 cun measurements between these two areas. So the directions say it's 8 cun below bladder 40 on the line from bladder 60 to bladder 40. You can measure this way. You go, there's 3 cun, 6, 7, 8. Here's the easy way to find bladder 57. It's in between the bellies, the two heads of the gastrocnemius, depending how you look at it. It's where they're splitting up or where they're coming together, just depending on how you look. So easy way, start at the Achilles tendon, go center line, move up. And as you move up, there'll be a depression you can feel that your thumb will fall right into. So I'll measure again here. There's 3 cun, 6 cun, 7 cun, 8 cun. So, it's a pretty easy way to measure. Then you just palpate into the acupressure point. But when we do one thumb meditation, so here's the structure. You have to have your elbow, a little on level with your wrist, because you're not going to be able to, move. You're not going to be able to make the motion if your elbow is completely extended. So you have to have it drop, shoulders loose again, just like rolling technique. And it looks like this. See, I let my fingers just kind of slide against Brian's medial leg here. So here I'm going from one side of the pad to the other side, side to side. This is forward backward motion, so like this. But you could also work side to side. And now we're just going to change direction on the same point. See, I can work like this as well. But if I'm going to work in this capacity, I probably would switch to this hand. It makes more sense to go this direction from side to side. But most likely I would just work at this point, like so. And we use bladder 57 for. You can use it for low back pain. You can also use it for tightness in the calf, cramping in the calf. Those are some common uses for this acupressure point. And then, let's see, it's another one I can do. All right, let's see. I'm trying to pick ones that are a little easier to find at first. Let's try bladder 42. Okay, bladder 42 is, yes, question.
Are you just on the skin for the sake of showing us how to find the point?
Yeah.
You don't need to be on the skin
No.
to do this.
You do not need to be on the skin to do one thumb meditation. You can do it right through the clothing. So bladder 42, if we look at the skeleton. Here's the easy way to find it. So bladder 42 is pretty much going to be at the medial border of the scapula, on line with the spine of the scapula, but you're on the inside. You're not on the scapula, right here. And the technical location is if you go to the third thoracic vertebra, and then you measure 3 cun laterally from the lower border of the spinous process, like so. It's going to put you right about here. Remember, this is a skeleton, so the measurement might look a little off just based on where the scapula is here. But it's going to be right here. That's bladder 42. Use that point for upper back pain, kind of like a burning pain in the back and shoulders. I like using this point a lot for people who work at the computer quite a bit, when the posterior muscles typically are getting lengthened, the front's getting a little shortened. This point will often go from the from the back to the front. And so here's I can pop a scapula out really easy. Remember this trick? So then I can feel for the spine of the scapula, and you're just, a little bit below the medial superior angle of the scapula. So here's the point, and then I want to use technique into it.
Did you say around T3?
Yep, 3 cun lateral from the lower border of the spinous process of T3, like so, or you can go side to side, either way. Now, you don't want to have your thumb bent like this when you're doing the technique. It needs to be like this. I use these fingers to stabilize my thumb, so I don't do like this with my fingers off. I keep fingertips on, they just slide over the skin. So that's bladder 42.
Do you ever do it in a fist?
You could, if you want to try to use a fist like that. That might be easier for some people. I usually do demo that as well. So you can go side to side if you hold a fist like so. Just make sure that you're not extending your thumb too far past the knuckle of your index finger. The knuckle of the index finger should support the thumb. So, and you go either direction again, this. So then we'll have you face up on the table. And then the next acupressure point I'll show is stomach 36. Stomach 36 is going to be right in tibialis anterior. And stomach 36 you can use for the energetics of digestion. You can use this point I like to use this point a lot for tightness in the tibialis anterior, the anterior portion of the leg. There's several points, stomach points you could use. Also, stomach 36 is indicated for like fatigue and weakness in the lower leg, and also it will help circulate qi and blood more systemically through the body. So, is it okay if I lift here again? Okay, raise up. So the technical location of stomach 36 is here, stomach 35. The location known as 3 soon, below stomach 35. And it's just going to be off the crest of the tibia. I work a little bit more into the tibialis anterior. Don't come right off the crest of the tibia. Move into the muscle a little bit. And if I was going to measure, I could go like this. It's going to be right where my index finger is falling. There's stomach 36 right here. The easy way to find it, you know, that's pretty easy, but the other way you can find this point is if you take your thumb and slide it up the lateral side of the tibia, the bone, there'll be a spot right around there where the tibia widens. So the tibia is swimming this way, but it widens here, and your thumb will fall right into the acupressure point. So that's another easy way. And you can use one thumb meditation, working in this point. You could stand in either direction, whatever makes more sense to you. So you can go back.
You slide it up this side tibia until you get to what?
There's a depression
A depression? Okay.
right there. We'll fall into like that. You know, I suggest trying it both ways when you're trying to find this acupressure point. And then I guess last one we could do. Try working in LI10. So LI10. So we have LI11. 11 is going to be if you flex the arm. There's the cubital crease, the lateral edge of it. Then if you extend, that's where LI11 is going to be, right at the medial condyle of the radius, or the humerus, I mean. And then we're going to move 1, 2 soon down from there. And I can lay his arm on the table.
And this
That's LI10. Yep. And LI10 you can use for shoulder pain, you can use for, you know, tension pain in the forearm. You know, it's a good point to help release musculature in the forearm as well. There's other things that point will do too, but we'll cover that more in point location class. Okay, so that's one thumb meditation. So make a group and